From chasing kids, long work days, or weekend workouts, women put a lot of stress on their joints, and pain often becomes part of the routine. But it doesn't have to be that way. Joining me from Orthopedic Physician Associates are Dr. Carrie Wilcox and Dr. Eva Young, orthopedic and sports medicine specialists. Hello.
Hello.
Thank you for being here. I know you both are very busy, so we appreciate it. First off, what does a non-surgical orthopedic doctor do?
Well, it's often a question I get actually in clinic, partly because people will call and say, gosh, I have a knee injury, or my knee hurts, my shoulder hurts, who should I see? And oftentimes they end up in one of our clinics because they don't know if it's surgical. And the nice aspect of having non-operative sports medicine people in an orthopedic group is we can see those patients, assess them, find out by imaging, ultrasound, MRI, if something is structurally wrong, or if it's something that doesn't need surgery and can be managed non-operatively.
Amazing. And Dr. Eva Young, I know you have a different specialty slightly.
Yes, so I'm a physiatrist, and in the field of physiatry, we also do non-operative sports medicine, but we have a more holistic approach where if someone comes in, we try to diagnose the problem, but we also want to get an idea of, you know, how do they live their life? What is their lifestyle like? What kind of goals are they looking for to achieve from the appointment? And we incorporate that information into the treatment plan by treating the whole person.
And Dr. Young, I want to stick with you. What are the most common issues that women are coming in for?
Yes, so women tend to see us for hip pain. Hip pain is very common in women. Just because your hip hurts doesn't mean it's arthritis. Bursitis is very common, as is tendonitis. Sometimes hip pain is actually coming from the spine, but you may not have back pain. Knee pain is also very common in women. In younger women, they tend to have what's called patellofemoral knee pain, which is kneecap pain. In women who are, menopausal or postmenopausal, they may develop more arthritic type symptoms. And then another common condition we see is frozen shoulder. Frozen shoulder is very common in women as well, and especially in women who may have some underlying autoimmune conditions, such as hypothyroidism. We tend to see more frozen shoulder.
Okay, and let's talk about everyday prevention. How do you know with your pain level when it's actually time to see a doctor?
I think it's about, was there an actual injury? Have you done anything for it? Have you tried icing, anti-inflammatories, rest? And if you've done all those and it's just not relieving and you're not able to do the activities you want to be doing, then it starts to become, I should probably have this at least looked at to see, could there be something I do for, exercise, physical therapy wise, change in how I'm approaching my workouts, that type of thing.
And joint pain isn't just based on age either, too, right? There's some things that we can do to prevent it.
I actually tell most of my patients when they say, is this just age, that age is not a diagnosis. There is often something underlying the problem, and you can be 80 years old and have no arthritis at all. You could be 40 and have terrible arthritis. So considering everything as, well, I'm just old, you don't have to live with pain. Okay,
what are some simple changes people can do at home?
Yeah, so move more. So, we tend to sit a lot more these days. If you're working, you're sitting at a computer. We were taught to have good posture, sitting up straight, or even standing at your computer is, what people tend to do more now. But actually, you want to change your posture often because it offloads your joints. So every 30 to 60 minutes, you should be getting up, moving around, just changing your posture. The other thing you can do is, carve out 10, 15 minutes in the middle of your day and just go for a walk. It keeps your joint range of motion. It's good for your mental health. Get some fresh air, and that's an easy, simple thing that you can do.
Those are tips everyone can do. Dr. Wilcox, too, we've made a lot of strides in non-surgical solutions. Tell me about them.
I think that's been the most exciting thing over the last 15 years or so. And it's first really started with what's called platelet-rich plasma, where before everything tendonitis-wise, you couldn't get better with physical therapy. Things kept kind of going on. What we actually realized was there's something sort of intricately with the integrity of the tendon that's going on. Or you've got just some mild changes in your cartilage and physical therapy isn't helping. Changes in modifications of your activity aren't helping. Some of these biologic injections are actually allowing to heal tendons that have not been able to heal on their own, but are not surgical because they haven't fully ruptured. And you can't just, sew the little tendon pieces together, but your body has the ability to do that. So it's enabled us to, and with the introduction of ultrasound in musculoskeletal medicine, it allows me to actually see pretty much any tendon in the body, all of the joints, and sort of structurally say, gosh, this tendon is not, the integrity, there's intrasubstance tearing is what we call it.
Okay.
And you can actually inject these directly into the tendon to allow your body to heal it.
Amazing. Thank you both for being here today and sharing all this information. We really appreciate it. And for more information or to schedule a consultation, visit the website that you see right there on your screen, opaortho.com.
New Day Northwest is sponsored by Orthopedic Physician Associates.